Okay. Hello, everyone. Welcome to today's webinar, Exploring the Current Landscape of Mental Health Apps and Their Clinical Applications. We have some amazing speakers here with us today to help us go through this very timely topic, which I'm sure you're receiving questions from your clients and to provide some additional treatment. Just a few notes. This webinar is being recorded and will be available on demand. You are welcome to submit questions at any time through the chat or the Q&A function. We will be answering those at the end of the session. Please note that this webinar is not available for CEs. If you have any questions, you can email me at webinars@adaa.org. I would love to hand it off to our speakers. So today we will have Dr. John Toros, who will be joining us shortly. He is the Director of Digital Psychiatry Division in the Department of Psychiatry at Beth Israel Deaconess Medical Center, which is a Harvard Medical School affiliated teaching hospital, where he also serves as staff psychiatrist and assistant professor. We also have Noy Alone with us, who is the Digital Literacy Director of the Digital Psychiatry Lab, and she leads the Digital Literacy Curriculum Development and Community Outreach. Thanks for joining us. And last but not least, we have Sarah Perret, who is the Digital Education Director at the Digital Psychiatry Lab and leads the team's Digital Navigator Training. It's a lot of the same word. Thank you both for joining us today. I'm going to hand it over to you to share your education, your knowledge.
Thank you. We're happy to be here. Okay, so you should be seeing our slideshow. So really what we're going to be talking today, this is our agenda. So we're first going to be talking about the current state of mental health apps, then move to how mental health app evaluations respond to some of the challenges plaguing the field, and then how you can use mental health app evaluations in your routine clinical care. So you might have seen this figure, this number before, but really there's a large interest in mental health apps. And we can just see that by the sheer number of mental health apps available in both the Google Play Store and the Apple App Store. Because there's so many mental health apps out there, the field is suffering through several challenges, which we will go over today. So the first challenge is a lack of regulation. So you can see from the figure on the left-hand side that the current regulatory framework that the United States government has put together for wellness apps is a bit confusing. In addition, we have the FDA's pre-certification program. So why are wellness apps so challenging to regulate? It's because they are so quick to update. Anyone can be a developer. Really, there hasn't been a precedent for a medical device that gives any really regulatory agency a precedent to base off their frameworks and policies. So the FDA responded with this by piloting a pre-certification program, which we can get into more detail if that's an area of interest. But really what the pre-certification program tried to do is streamline the regulatory review process so the FDA could keep up with a rapid pace of app development and updates. Unfortunately, this pilot program never advanced out of the pilot stages and has since the FDA has since decided to terminate it and adjust to something new, which in the future we're anticipating to see what that would be. But really, in a nutshell, there is no standard federal regulations for these apps. Because there's no real standard that these apps have to meet, there have been many reports that report privacy and data security concerns regarding digital health. So this is just a summary of one study that was conducted that found that almost 28% of the apps that they looked at had no privacy policy. So absolutely no information for consumers and clinicians of how those apps were using the data that was getting inputted. In addition, 47% of the data transmission complied with the privacy policy, which means 53% did not. In cooperation, Mozilla had a great report that was released May of this year that looked at the privacy policies of top mental health apps and ranked them by the creepiness level. So we are seeing that there's a big concern surrounding privacy practices and data security around digital health. The third challenge is we don't know a whole lot of the real world evidence and efficacy of these digital health apps. And one of the challenges is that we don't, again, because there's no precedent of a medical device or a software that's been used like these mobile mental health apps, the regulatory agencies and also the developers of mental health app evaluations are not sure what evidence is required. What type of evidence do we need to say, yes, this mental health app is effective, we should recommend it? Is it a randomized controlled trial? Is it possibly an observational study? What kind of evidence do we need? There's no standard that's been set that, yes, we need an RCT or we need some other type of study that shows the efficacy of these apps. As a result, the kind of not a lot of scientific literature that's out there, it's very hard to compare the studies because there's no standard once again. So it's really, as this figure is trying to suggest, it's comparing apples and oranges. How can you compare a study that was an RCT that used a digital placebo compared to an observational study that had no control group at all? It's really hard to compare these efficacy studies. And when people try to do that, as shown in the figure on the right-hand side, we have to then kind of break down the studies in more specific categories just because there's no homogeneity across studies. So what this meta-analysis did is it looked at, okay, let's look at the specific type of control groups that mental health app primary literature used. Was it an active digital placebo? Was it an inactive digital placebo? And as you can see, as the control groups differ, so do the effect size. So really what we're seeing, and this study suggests, is that the effect size of these apps really depends on what control group you're testing them against. So there's not, in a nutshell, there's not a lot of standards surrounding what kind of evidence these mental health apps need to present for them to be deemed effective. And finally, users aren't really engaging with these apps. If we're looking, so these two graphs are looking at just observational real world engagement rates of time after people download an app. And you can see by day 10, there's really this 90 to 95% cutoff. So we're finding that users on their own, yes, they're downloading and there's a huge interest in mental health app, but there's not a lot of sustained engagement with these apps. And this study summarizes some of the potential reasons for why there's this barrier of those subsequent interactions and sustained use. And it suggested that people are actually downloading more than one app because some of these apps have limited features that are preventing these subsequent interactions and sustained use that we would like to see with these mental health apps. So we really need a solution that can respond to all of these current challenges that are plaguing the field of mental health apps. We have a lack of regulation, we have safety concerns, unknown efficacy, and limited user engagement. So how can we respond in a way that all four of these challenges are integrated into that response? And this is where I'll leave it off to Sarah to discuss mental health app evaluations.
Thanks, Noi. Next I'm going to discuss mental health app evaluations and how these address the 4 points that Noi just mentioned. So there are numerous frameworks. We'll go more in depth later on into our own just because we built it so we know it best. But the similarities across all of the frameworks, they assess security measures and clinical measures. And but the differences are they have different summary scales They're made for different audiences, whether that be a clinician or a patient or just a user or a family member. And they also have different question types. So they ask different questions about the apps and ask about different things, whether that be privacy policies or engagements. And they ask them in different ways as well. And so to respond to regulation, we have to be able to fully capture all of the attributes of mental health apps. And there's two different important attributes. There's the subjective, which are going to be different across each users. Things such as, is this app usable? Is it aesthetically pleasing? All of those answers will be different for different people. And so a star rating couldn't really answer that because it's hard to integrate into a universal score because, again, it will be different for everyone. And then there's more objective questions like when was the last time the privacy policy was updated? Or how well does this app work? Like, all of these things are not going to depend on the user, but they're going to be more objective questions. And so a framework needs to do both and fully capture an app. And so some responses to safety, these are 4 different frameworks. And so the MARS framework made new scales. Cyber Guide is another one, and they score privacy policies. Orca does a really good job of automatic re-reviewing apps through an automated process. And then MindApps updates its ratings every 180 days. And so to respond to efficacy, the challenges are that we don't know how users are using apps. There's little transparency there. And there's, as Noi mentioned, there's low quality of scientific and clinical evidence. And so to respond to this, the frameworks need to incorporate real-world data and evidence to fully assess these apps. And so to respond to engagement, the frameworks can increase users' trust because it allows them to choose an app. And so they have more buy-in because they're choosing an app that's right for them and they're choosing parameters that matter to them. And so this is MindApps, which is our framework that our lab built. And so the screen just shows an example of what it looks like. But through this framework, you can get personalized recommendations and you can search apps that are easy to use for you. And so in this way, again, you can increase the engagement of a user because they have chosen which app matters to you. So it answers the subjective part of that. And then for the objective part, you can look at, does it have a privacy policy and what is the evidence behind this app? And so now I'll pass it on to Dr. Torres to talk about clinical applications.
I'll let you guys drive the slides. I'll just say next slide as an example. So I think this is a view of the website that hopefully all of you can go to right now. It was up 5 minutes ago. It's always up. That's probably an inappropriate joke, but you can also find it through the ADAA's website. As we said, they mentioned Cyber Guide, which Sarah covered, which also gives information about apps and can be very useful. Really, again, different approaches to how you want to find an app. I think there's a lot of overlap between all of these systems around it. But what you see on this screenshot of MindApps, and again, you can duplicate it at home too, is right here the filters for schizophrenia, being totally free, has a privacy policy, and can delete data have been picked. And it basically shows these apps that show up. So again, you can imagine you can give this to a patient, you can use it yourself, you can give it to a family member. There's no right or wrong set of filters. Some people actually don't care about privacy. We may have a patient who's a social media influencer and talks about their illness and really could care less about what the privacy policy is. Whereas Sarah, Noi, and I may care a lot about privacy and not want people to put their data out there. So we're not saying there's a right or wrong threshold for these per se, but more it's a continuum. So again, you can find this through the ADAA's website. You can also explore Cyber Guide there. You can explore Mind or just go to mindapps.org. We can jump to next slide. So I think if we looked at where the foundation of this actually came from, MindApps stepping back, it came from about 6 years of research with what we call the American Psychiatric Association's app evaluation system. The system actually is not unique to psychiatry. Mental health apps and technology, no matter what you are, if you're a peer specialist, you're a nurse practitioner, you're a social worker, you're a psychologist, it is very universal evaluating these. And in the latest iteration of the American Psychiatric Association system, we invited all of those different professionals to be part of it and update it. But the background and the reason it's a pyramid is where we want to start on level 1 to make sure whatever we're using is credible, accessible, it's ethical. And then level 2, right, to make sure it's private and secure. Like, you don't want to give your patient something that's going to be harmful or dangerous. Level 3 is going to be evidence-based, which makes sense, right? You're looking at the risk-benefit. And level 4 is going to be ease of use. If people don't engage with it, there's no point using it. Then level 5 is, how is the data going to get back into clinical care? What is it going to do that influences them? You probably don't want people tracking their steps forever. Maybe you do, and that's fine. But usually you want to have kind of a goal. There's a reason to do it. So hopefully all of the levels in this system, to some degree, make sense of what it can do. We'll jump to the next slide. So again, you can look up on, you can just type in APA app evaluation system and find videos, questions, examples have been filled out. But I think what we wanted to really do was, again, find a way to have it more in a database that was searchable and continually updated, because if you guys are like us, you don't have a lot of time between visits to kind of sit there and go look on PubMed and see what it is, or read the privacy policy in great detail. So the idea for this, I think, makes sense, that we like the principles of things are safe, effective, and usable, but how do we actually realize it? So we'll jump to the next slide. So again, as you kind of saw in that quick preview of Mind Apps, we have just over 100 questions. We call them objective. Perhaps nothing is truly objective in life. We can have a whole philosophical debate afterwards. But the reason we call them objective is it kind of says, do you have a privacy policy? Yes or no? Can you delete data? Yes or no? Do you claim to treat depression? Yes or no? Do you claim to offer CBT? Yes or no? So the idea is we kind of can break up a lot of those things about where the app comes from, its privacy, what data it takes in about you, what data it shares about you, its clinical foundation right to evidence, how it engages, and how it shares data into yes, no questions. And of course, there is some loss of subtle information. We have to go to yes, no questions. The advantage is you can search it rather quickly. So we can jump to the next slide. So these are examples of some of those yes, no questions. I won't go into all of them because, again, you can go to mindapps.org and read all of the questions, but they make sense, right? Is personal health information shared? Is de-identified data shared? Can you delete your data? These are things that may or may not matter depending on the app and the person using it and what they're using it for. Most apps won't meet HIPAA. They don't need to meet HIPAA because they're not claimed to be healthcare devices. Some will. So again, Noise and I are not saying you need every app to have every feature. It's just interesting to think about which ones matter to you and the people that you serve. We'll jump to the next slide. So again, we don't imply any endorsements, but we'll go through some examples, and I may hand it back to Noy and Sarah to look at it. So you can play along at home with this, or you can do the examples with us. And again, every app on the website, it's educational, it's informational, it's your clinical judgment if you want to use it or not. We'll go next slide, sorry. I can lead us through the cases then of what it is. So we can, again, I'll read the case out. So a client's experiencing depressive symptoms and potentially mood disorder. They're interested in using an app to log their mood every day. In their spare time, they enjoy writing in a journal. They prefer to have an app where they could connect with someone, such as a therapist. The digital navigator asked them if any engagement features would make the app more useful for them. They believe videos would be very useful. And they feel strongly that the app should meet HIPAA for whatever this person wants more protection. And you think it would be useful to have a crisis management feature. So again, rather specific on what this person would want. And if anyone wants to put it in the chat what they think the best app is, you can do it. It's hard to know. But if we flip to the next slide, we can look at kind of some of the keywords, right? So this is someone who may have a depressive disorder, mood tracking or logging their mood is very useful. Having a journal could be something we want in the app. They would like to be able to connect with a therapist. Videos would be useful. The app should perhaps meet HIPAA. And in this case, again, a crisis management feature could be useful. So again, a lot of specific detail that you can pick up on what someone wants. And of course, each patient will be different. The reason that we put these words in bold was these are actually filters that we can go put directly into Mind Apps and see what comes up. So maybe we'll give people a minute if you want to go to mindapps.org and actually navigate them, and you can put these in and see what happens. We think we know the answer, but because we update apps fairly frequently, as Sarah said, 180 days, sometimes the answers will change. Sometimes apps will disappear from the stores, will come back and forth. And we think, well, all of you have seen apps come and go, right? Even on your own phone, some of them will disappear. So it's always a little bit of a mystery what will come back of different filters. But I think that's where it requires your clinical judgment and skill to make sure that what the app is offering today makes sense and to at least give it a look over. As you're looking at these filters or putting them in, one thing to keep in mind is we actually don't evaluate the quality, say, of the journal experience or the quality if it offers CBT. That gets very difficult to say this is good quality or bad CBT. I think that that's a little trickier. So in essence, we're saying, does it claim to have this as a thing, yes or no? Not is it high or low quality, because that can lead to disagreements or be very hard to kind of keep up to date, and there's not a great standard for it. So if everyone online hopefully has had enough time to enter the filter, should we look what the answer would be? So in this case, it was an app called Sundelo, Anxiety and Depression. Again, we're not here to endorse it. We're not here to say it's good or bad. We're just saying if you put in those filters, that's what you may get. And we can jump to a second case right now as well too. So a client is having trouble sleeping, is feeling really down and unmotivated, and reports experiencing anxiety from school pressures, not too uncommon. They've used CBT before and felt it actually helped and had a positive effect. They have heard about the benefits of meditation and deep breathing and want to give it a try. Their ideal app would be one that's both self-help, where they can manage their own information, and has some reference where they can learn more about what they're experiencing. So I think a lot of people will probably come to you in some ways asking for an app, right, that offers some information, offers some perhaps meditation skills, breathing skills, and what they want. So again, you can probably just extrapolate this to people you work with. But if we jump to the next slide, we can see, so the person says right there, falling asleep will be a filter if you look on Mind Apps. Feeling down and unmotivated will be one. Anxiety will be one. They may want CBT or not. In this case, we weren't exactly clear, but you could ask someone. You actually can go into a database and search with or without CBT. They're interested in meditation, deep breathing, which there's a lot of interesting apps out there. They're interested in self-help, and they'd like it to have some reference information or psychoeducation. So a lot of details. And again, as you search through it, you don't, of course, have to put all of them. You could see what happens when you look for an app that has the CBT or doesn't have the CBT as part of it. We'll kind of find out what they are. But I'll give people maybe 20 seconds to kind of look at some of those filters or see what they could be in these cases. And of course, you can vary them for interests of people that you would want. We've tried to actually make these cases go where it's usually one unique answer. Sometimes you'll put a search in and you'll get no unique answer because you've asked for things that just don't exist, or we haven't, I don't say don't exist, that we haven't indexed yet. Or sometimes you just say, show me all the CBT apps. It may say, here's 100, and then you can be more specific. So sometimes when we're working with clients or patients, it's kind of, we look at how much can we ask for an app? And then we kind of modify the search. And we talk to someone and say, are you willing to kind of, if you pay, there's more apps available. If you want it totally free, there's less. And we kind of compromise or go back and forth with the person to find what's available on the marketplaces. The one thing I'll say is we're looking at these apps. You'll notice what we're not doing is we're not putting stars, and we're not looking at number of downloads. We're hopefully picking these apps a little bit more based on features that would matter to a person. So we'll jump to the next slide. So in this case, it came up with an app called WISA, an anxiety and therapy chatbot. Again, we don't imply any endorsement, but if you got anything different, you can put it in the chat or let us know later. But we think that's the most current answer as of yesterday. for what it is. And we'll do one more case. So for scenario 3 is your client is a Spanish speaker and is looking for an app available in her native language. She suffers from anxiety. She doesn't think there's an app out there for her because she shares an apartment with several people. So Wi-Fi is usually not that strong. You inform her that there are apps that function offline and you can help her find one. She is only willing to download an app that is totally free. She also mentions that her therapist suggests that she incorporate deep breathing into her exercises each day. Your client will only trust apps offering that are supported by clinical studies to prove that they work well. She's looking for also an app that may help with her productivity. So I think this is often a common case of not everyone has great access to internet. A lot of people do, but it's worth asking people, just because you have a phone, do you have a stable internet connection? Is it strong? There are apps that work in offline mode, right? That you would say use on an airplane in airplane mode, and that's how you can test it. So if we click next one, we can look at the filters and we can see that, right? We can look for apps that would say support Spanish, anxiety. Offline mode is this way to say, does the app work in airplane mode? Do they not have to have internet? So they have to have internet to download it, say in your office, or if they're at home, this could be a trouble. The totally free filter is the cost one. It's the filter that's probably the most used we've seen by people. This means there's no secret, it's not like free to download, there's not a free trial, there's not a secret subscription. It really means totally free. And these are usually apps that people like. We saw a deep breathing filter before. And again, this person supporting clinical studies, again, we don't rate the quality of the clinical studies, we just say, have there been studies? So again, we have to be a little bit careful on this filter. It's better that someone attempted science and did science. It doesn't mean it's really going to be evidence-based per se. And that's something you can certainly educate clients and people that you work with. So, and again, Spanish is a filter that we have right now for languages. So I wonder, let's see what the answer is for this one. This would be Virtual Hope Box, which is actually made by the Veterans Administration, by the VA. The VA puts out a lot of very good free apps. Sometimes people say, well, it's an app made by the federal government, the VA, it's only for veterans. That's not true. Usually the VA apps are a very first good bet to go for anyone in the civilian world. Our team ends up probably recommending the VA suite of apps. Often is the most often, and I think other app rating websites will also recommend. Usually you'll see the VA apps will come up very highly as well too. If we jump to the next slide. So I may pause on talking here and let someone else cover these ones.
Yeah, I can go ahead and take it from you, John. So really what we've been talking about is recommending apps using mental health app evaluations in your clinical daily care. But we understand that many clinicians, they're very busy, they have other obligations, they don't have a lot of time to sit down and kind of go through mind apps. What our team has envisioned is a new healthcare position that kind of would take over that responsibility of integrating mobile devices, smartphone apps into your clinical care. And we have named this healthcare position the digital navigator. So you can see what really we've been talking about today is the first role that's in the box of what the digital navigator can do and how that benefits both clinicians and the patients. We do have a training and a manual that's been peer reviewed. And that training really goes into not only what we've been talking about today, app evaluation, but also the other two core skill sets that we think a digital navigator will be equipped to do, which is technology and troubleshoot and app data and preview. And really what the digital navigator, what we envision is, here's this person that can be a bridge between patients, clinicians, and really any digital health technology that's getting more and more integrated into care. So if you're interested in navigating patient portals, you're interested in making sure all your patients can come to a telehealth visit in addition to downloading smartphone apps, this is really what a digital navigator can be equipped to do. And so kind of the case studies that we've been talking about today are really an example of a patient coming to a digital navigator and having that discussion and finding an app that's relevant to them. So just to break it down, a patient expresses what kind of app they'd like, and that digital navigator can help them use Mind Apps or any other mental health app evaluation framework to find an app that's really relevant to them. And then what a digital navigator can do is check into with that patient to see how they're enjoying their app, if there's any additional technology issues they need help with. Does that app give any interesting feedback about that participant? For example, some apps allow you to track your mood. If that digital navigator asks the patient, hey, can you please open the mood tracking feature? Let's see how you felt over the past few weeks. Can that digital navigator and that patient now have a conversation about how they felt? And that digital navigator can then pass on information on to the clinician. So it's really this kind of bridge position where that digital navigator can connect that patient, the clinician, and technology. So everything is very cohesive and unified. Our team does offer many resources if you're interested in either becoming a digital navigator, training a digital navigator. We have, like I said, a manual. We do in-person trainings. In addition, we have an online supplementary training that is just a reinforcement of what the in-person training offers. So we have a very kind of robust training if having digital navigator is something that aligns with your organization's goals. In addition, we've been talking about mindapps.org, and we understand the Mind Apps is a little confusing. Some people might need help or assistance navigating the website, understanding what the website has to offer. So we've made both clinician and patient-facing handouts that describe mindapps.org. We also recognize that while all of this is great, using smartphone apps, using mindapps.org, joining in telehealth, that all these ways that we're starting to use digital health technologies in care requires a core competency with a smartphone. So the patient, before they can even think about downloading a mental health app, before they even think about going on to mindapps.org, needs to be able to turn on their smartphone, needs to be able to know how to connect to Wi-Fi, needs to be able to know how to download an app on the App Store. And that's really where this digital skills training comes into play. We found that digital skills training is where we teach mainly adults with serious mental illnesses, but it's not exclusive to that population, how to use their smartphones in their daily life, and really giving them the core competencies that then allows them to integrate their smartphone into their clinical care and to promote their well-being in the ways that we discussed today, whether that's downloading a mental health app, whether that's talking to a digital navigator over Zoom. That's really where this digital skills training. So really, we just wanted to give everyone here a brief overview of the resources that our lab offers, because we know though mental health apps are an important, interesting, and relevant way that you can use a smartphone in care, there's a lot more ways that technology and smartphones are coming up in routine clinical care that might not be specific to mental health apps. And that is our last slide. So this is our website. This is Dr. Torres's email. We are always open and welcoming any questions, collaborations. We share our materials freely, so we're open to any responses. And I think now is time for the Q&A.
Yes. Hi, everyone. Thank you. Welcome. So we do have a few questions that we've received. I want to start off with one that, what do you think is kind of how mental health apps can collaborate with traditional clinical care? And are psychiatrists and psychologists that you've been working with or collaborated with, are they receptive to using mental health apps in their practices?
I think people do want to use these apps, both psychiatrists and psychologists. I think sometimes it's the app developers underestimate. There's a lot of implementation barriers to bringing an app into your care. And I think that's where it really is useful to have either a digital navigator or someone that can assume part of that role. Because what are you going to do with all the new data that comes in? How do you ensure everyone can set up the app? How do you kind of keep checking that the app is updating? So I think in some ways, all of us likely listening use apps. We like them, and I think we use them as kind of in our non-clinical world. But when it enters the clinical world, I think we almost have to think of it like a tool, and what is the team to support the tool? And I think a lot of times we don't think of what is the team around the tool. And I think if we think of it that way, like if we bring a new CBT manual into a clinic, it doesn't mean everyone gets CBT. We have to have a CBT clinician. So that's where I think our analogy, if we bring a new app into a clinic, it may be something like a digital navigator. And as we briefly showed, the training is not wild. It's 10 hours. It doesn't need to be a professional. It's a great role for a peer, perhaps, to assume. But I think we just need a little bit of extra help in that integration. And then I think people would use them like wildfire.
That's a great point. There's an increase of technology in healthcare, especially since the COVID-19 pandemic, where telehealth became a standard practice. How might mental health apps kind of help bridge the gap between these telehealth patients who maybe aren't able to go in and see their clinician?
Yeah. I'll start with it and then maybe hand it to Sarah. I'll say, I mean, smartphones are the most common device that people use to access to internet and probably do telehealth, especially for people with lower socioeconomic resources. They may actually be smartphone dependent. So the phone is the only way they connect to the internet. So I think first making sure that we're kind of a smartphone focused way is important because a lot of people don't have a laptop or desktop with kind of a broadband access. It really is the smartphone. So I think even if we want to connect people to telehealth, we have to start with probably the Zoom app is the best way. It's not sending people a Chromebook, but I'll let you pick up from there, Sarah.
Yeah, and also I think that it can bridge the gap also when people are on waiting lists and things like that. You can use apps so that you have some sort of either therapy or some sort of therapeutic measure like meditation to be able to sustain some sort of treatment for your own self before you actually get access to full treatment.
That's a great point. The waiting lists remain very long in many clinical practices, so that can be a helpful tool while people are waiting for treatment. Following along that, is there perhaps a disorder or treatment that translates best to the use of mental health apps?
Sorry, go.
I kind of want to answer like the converse of that question is we found that the mental health apps for more serious mental illness, such as like bipolar disorder, schizophrenia, are not equipped really to support that population and tend to also be more prone to just have stigmatizing content and inaccurate information. So for those specific populations, we've just found like if you go into Mind Apps and you click on those supported conditions, you'll see that there's just not a lot available. And the apps also tend to not offer many resources. They tend to be just more educational reference based instead of self-monitoring techniques. So even though that's like the converse of the question, I think when you maybe are dealing with patients who have more serious mental illnesses, we've just found that like apps are not ready to support the level of care that they need.
Which is not just, it's funny, the research evidence, they do it. Like there are research apps that you and I just can't access from the webinar today, because everything we've put in our database, everything in other databases like CyberGuide, those are ones you can hopefully download and use. So there is this interesting kind of research to practice gap in the app world that's unfortunate. But I would say a lot of exposure therapies can be useful ones to start with an app. Those are kind of, we didn't talk about VR systems, but classically kind of exposure therapies in some ways can well be facilitated by an app or technology. If you want to track mood or do mindfulness, my God, there's hundreds of these apps out there. Like I think our filters for those two are just like overwhelmed. So if you're interested in that, you can actually be a pretty picky consumer. You can say, I want to be free, I want to have privacy. As Noy said, if you're like, I want an app for bipolar disorder that's evidence-based and free and has this, there may be nothing else out there right now, unfortunately. So it's not a even marketplace, unfortunately, on the app stores.
That makes sense. Following that trend, we had an attendee who's interested on how apps get added to your database. How are they vetted, and is there any basic criteria they need to meet?
Yeah, so Noy and I lead the team of adding apps. And so we usually had a team of volunteers that we train. And so apps get added through an app store search. And so we'll search, say, depression, and then we'll look through all the depression apps and then add the ones that pass a basic eyeball test. And so as long as they're functional and non-stigmatizing and seem to have generally good content, not really a judgment, just like this meets basic standards of what I want an app to be. And then we'll add that to our database and go through all of the questions. And then all of that initial app rating is then updated every 180 days. And so with that app check, we check if it's functioning, check if they updated it, and see if they added something funky to it. If that's the case, then we take it off our database. So we really maintain the apps that are like on the database pretty well.
Yeah, and everything has to be like publicly available. So me and you have to be able to download it and use it. Initial upfront cost to download has to be less than $10. So we're not having apps that cost like hundreds of dollars. And all the apps in our database, as we go ahead and update them, we check that they're updated within the last 4 years, just to make sure that when users do download them, they are still functional and compatible with whatever operating system is on the phone at that time.
I'll say if people want to add apps, if you found a cool one someone is using, you can probably email ADAA and they can probably tell all of us what to do as a central hub, because clients and people find really awesome stuff, and sometimes it may not directly look like a mental health app, or it may kind of be labeled in a funny way. So we get a lot from word of mouth. We try to look at what's most popular. So if you're not feeling well and you type in anxiety, what comes up? And it also may be, if you're looking at apps, one that we've rated, sometimes they change within a week and you may go, oh my gosh, this one has now become an adult entertainment website. Let's remove this one. So we're open to both adding and removing.
I'm curious about your thoughts of the mental health information that gets put out through social media, whether it be TikTok or Twitter, and how a user should manage that information.
It's tricky because there's two issues, right? One is, I think we're seeing a lot of unlicensed therapists acting as therapists on social media platforms. And there's probably a very good reason that people go through licensure and develop that training. So I think sometimes people are sharing their own experience, which is valuable, but it may not reflect a broader experience. So it's not, no one's trying to cause harm, but they're probably overgeneralizing what worked for them. I think what's also tricky is we've looked at how information spreads in research studies on Twitter, at least, and we found that although there's stigmatizing content is real, it spreads the fastest of all content. So misuses of kind of the word schizophrenia, negative connotations, where sometimes people are sharing inspirational tips and hope. There's more of that, but it doesn't spread as much. So it's a little concerning that bad stuff spreads quicker, but most recently, right, that you have these kind of content creators who mean well, who communicate brilliantly, but sometimes maybe giving kind of inaccurate or not useful diagnosis. So it's an evolving frontier of what social media kind of brings to us, but that's the new one, is unlicensed therapists.
The therapy of the social media influencer, I guess.
Yes.
I'm going to start wrapping it up, but merging kind of our last question. What determinants should a client use when they are downloading an app, or what should a clinician look into if they're providing a recommendation to their client?
Maybe we can each go quickly. And so my favorite filter is to find one that's totally free first, like you may not need to pay. And at least look, does it have a privacy policy? That's just 2 clicks. Does it have a privacy policy and is it free? You'd be surprised. You can really narrow down apps by just those 2 questions. Sorry, I took the easy one, Sarah and Roy.
My favorite is supporting evidence. And so I just usually click that. And then sometimes if that's a really concern for you, you can always just quickly Google the name of the app and then see if any scholarly papers come up, which is also a good way to, like, if you have, 10 apps that you're getting on a filter, then you could just narrow it down by that.
Yeah, I would recommend just like a very basic question, like what do you want the app to do? Just have like one feature in mind, because I think it just makes the app a lot more relevant to whatever you're downloading. So specifically, if you're a clinician and you see, or you're a patient, let's say you're a patient and you just want to like track your mood, you just want to meditate, just having like one basic idea of a feature that you want to get out of it is helpful and it's useful, and it really quickly narrows down, especially if you couple it with either cost or the supporting evidence will really shoot down a lot of apps.
Very true.
Okay, well, thank you so much. I think that we are ready to go out into the world of mental health apps with a little bit more foundational information, allowing people to start doing the search themselves. I want to thank you all for joining us today, as well as our attendees. Again, Mind Apps and Cyber Guide and additional mental health app information is available on ADA's website. So if you have any questions, please feel free to reach out. Also, if you are not yet a member, please feel free to join for access to great webinars. And the ADA conference is coming up, in which we think Dr. Torres will be attending.
We hope so. Excellent.
All right, thank you so much, everyone. Have a great day.
Thank you all.
Thank you.
Bye.
Thank you.